أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Assalamu alaikum and welcome back to our daily iTVusa show, Balancing Deen and Dunya. My name is Dr. Suzy Ismail and I'm happy to be with you again as we continue to learn more about inspirational community members, leaders within the Muslim American community who are on the front lines doing incredible work in leading organizations, in heading up masajid, and just being of service to others. One of these individuals that we are so honored to have on our show today is Dr. Omar Shareef. Dr. Omar is an incredible resource within our communities, and I appreciate the fact that he is able to join our show despite being incredibly busy with patient care. He is a community educator at the Family and Youth Institute. He also holds an MD and an MBA dual degree from St. George's University School of Medicine. He is an incredibly busy and also empathetic and highly sought after, I believe, psychiatrist. He completed his general psychiatry residence at Nassau University Medical Center, and he also completed a public psychiatry fellowship and is certified in psychodynamic psychotherapy from Columbia University. Currently, he practices at Creedmoor Psychiatric Center in Queens, New York. He is certified as an adult mental health first aid instructor, and he is a member of the HEAL Collective, which is a New York-based nonprofit dedicated to Muslim mental health. So I'm thrilled to invite Dr. Omar onto the show now. Assalamu alaikum. I was like, I'm happy to welcome him, and I wasn't sure if you were going to pop up or not, but I'm so happy that you could join us, Dr. Omar. Clearly, as was indicated in the first few minutes of you trying to connect and join our show, you're very busy in the field of psychiatric care, in really addressing some of the severe mental health issues that we see in our community. So I'm going to turn the floor over to you a little bit. And if you could just guide our audience and our viewers into a better understanding of what it is that you do and why you do what you do.
Sure, of course, absolutely. First and foremost, I just wanted to give my thank you to you, Dr. Suzy. Thank you so much for giving me the opportunity to join the show and be a part of this. I got to say, I did watch a couple of previous episodes of some of your previous guests, and I got to say, I really love what you're doing here and like allowing others to like have a spotlight shine on them. And the work that they do. So it's an honor for me to be here. Thank you so much for this, and for all of our viewers too. Welcome. It's nice to have you all here too, whether you're streaming live right now or watching the recording after we're done. So to start, it's a tough question to answer. So like why I'm doing what I'm doing. I would say it's a rare thing for folks like you and I. Our field, psychology and psychiatry and mental health, Muslims are actually quite a minority here. There aren't very many of us actually in this field. And for me, I remember when I was first going into medical school and applying, I was actually interested in doing emergency medicine. I wanted to become an ER doctor. That was like my first dream that I had. And the idea was that, you know, you'd watch these TV shows, you'd watch like, you know, these dramas, and you'd see this huge big thing happening where like a patient's being helicoptered to a hospital, being rushed through stretchers, or having like all these big machines and stuff. You've seen the defibrillator shock them back to life and all that. Really dramatic stuff. And I thought to myself, wow, this is saving lives. Like, this is how you save a life. This is like really cool, dramatic stuff. And so that's what I thought I wanted to do. And it wasn't until later on in my third year of med school, this is where I started encountering a personal mental health issue where I myself had an episode of depression in my third year of med school. But then in addition to that, I had a few colleagues of mine, fellow students, that were also afflicted with pretty serious mental health issues. And I realized that in order to save someone's life, you don't really need this multi-million-dollar huge medical apparatus of all these different machines and all these different like algorithms and things to like help save a life. Sometimes the most important thing to save someone's life is just a heart-to-heart conversation, letting someone know that you're here for them, that you understand the pain that they're going through, the suffering that they're enduring, and that you're willing to help ease the burden just a little bit by allowing your heart to be open to them and allowing them to open their heart towards you. And so I realized that, no, this is actually a way to save people's lives. And so I guess it really resonated with me. And I decided that I'm going to go into the field of psychiatry. Psychiatry is the field of medicine that concerns itself with mental health. So we are mental health specialists as clinicians. And so I decided this is what I want to do with myself. This is the field I want to get into. And I can tell you right now, ever since making that decision, I could not have been happier.
SubhanAllah.
This, Dr. Suzy, is where I feel the most natural and where I feel the most fulfilled. Alhamdulillah. It's a blessing that Allah has guided me towards working in this field. And I would venture a guess to say you probably feel the same way yourself after you got your doctorate.
Alhamdulillah. I think, you know, you really hit on some important points. It is an incredibly rewarding field to be immersed in, you know, mental health and emotional wellness, relational wellness, and approaching it from different avenues. I know many people still have hesitation and are often a little bit confused maybe by the entire scope of the mental health field, particularly here in the US, you know. So a lot of times, you know, the field of psychiatry is looked at as just medicate, medicate, medicate. And the response to that, well, I don't want to be medicated. Or the field of psychology is that, you know, why am I going to open up trauma boxes when I'm functioning just fine? How do you respond, Dr. Omar, to those hesitations, particularly within our Muslim communities?
It's a very layered question because it brings up a lot. I guess the first thing I would say is let's start with the field itself, like the actual field of psychology and psychiatry. And the first thing that I would say is I think it's a misunderstanding that we as a community have that this particular field is something that is Western, something that is European, something that is like alien to our heritage and our history as Muslims. And I would argue, and this is something that I know that Dr. Rania Awad has done like a lot of actual work and publications in, which is reconnecting Muslims to where our history was with psychology and with psychiatry. That our understanding is that this particular field, this particular area of study is not necessarily something that was Sigmund Freud's, you know, baby, and this is all Western. Therefore, it's not something that jives with our history and our heritage. The truth of the matter is that Muslims were actually the pioneers in this particular field. Muslims were the ones who actually created the first psychiatric hospital. It was in the Muslim world that we actually provided mental health care. It was in the Muslim world where the psychology, the emotions, the mentality, the persona, the behavioral and cognitive aspects of a person's health was something that Muslims already holistically understood to be a major part of our treatment. I think this is the major problem we have, is that our current Muslim community has sort of lost sight of that. And therefore we see this field as something alien, when the truth of the matter is that this field was already ours to begin with. This is simply a return back to where Muslims should be and where we should be pioneering again for. So that's in terms of just the field itself. I would say that in no way, shape, or form is seeking psychological help or seeking psychiatric help something that is antithetical to our identity as Muslims, or something that means that we're turning away from Allah if we're turning towards a counselor or a therapist. It's one and the same. We provide the same level of healing, the same type of healing, that if you broke a bone and you see a doctor versus if you broke a heart and you see a psychiatrist, it's the same thing, essentially. It's just that one is very obvious, the other, not so much. You know, it's more invisible, but that doesn't make the pain any less real, whether it's mental or whether it's physical. In terms of the second part of the question, Dr. Suzy, this, I think, concerns stigma in particular. And this is one of the other major barriers, that even if you acknowledge that, yes, maybe I do need help, or yes, maybe there is a problem, or yes, maybe this field can provide something for me. But the major problem that we see in the Muslim community is, well, I don't want to seek help and I don't want to be seen by this, because what will people think if I'm being seen by a therapist or a counselor? What do people think if I have a mental health issue? What will people think if I have a psychiatric diagnosis? What will people think if they know that I take pills or take medication for mental health? They'll think I'm crazy. They'll think I'm like Majnoon. They'll think I'm possessed. They'll think very negative about me. This is because our perception towards mental illness is rooted in a lot of stigma, a lot of misunderstanding, a lot of ignorance. And based out of that is the stigma that this is something where it's not legitimate, it's not something you should seek, it's not real. And even if it is real, I can't get that help because what will people think? What will my family think? I'm not going to get, my spouse might treat me differently, or might affect me with my kids, or I'm not going to get married, or my community will treat me differently or look at me differently. So there's a deep, deep feeling of shame and embarrassment when it comes to this. And we don't ascribe this to physical injuries. We only ascribe this to emotional.
Yeah, subhanAllah. And this is why, many times we see the manifestation of mental and emotional pain as psychosomatic, where people may feel more comfortable seeking help for consistent stomach pain or nonstop headaches, but that could be a form of masking, actual emotional, mental health difficulties they're struggling with. So, Dr. Ahmad, you started out this conversation, and I was so happy you did, by being vulnerable and, speaking about your own personal journey in experiencing depression. And, you mentioned it in a way that, someone might mention, like, I had a stomach ache, a week ago, or, I thought medical school was difficult, other difficulties and struggles and tests that we have that we're comfortable talking about. A lot of times we're not comfortable talking about that. So I want to go a little bit deeper in the personal level now. We know that a lot of our viewers, a lot of our audience members have probably gone through difficult experiences as well, have gone through bouts of sadness, bouts of grief. At what point do you start to maybe recognize that you need help, that this may be depression and not just a depressive episode or situation, but really chronic or clinical? And what do you do about it?
Well, first thing I would say is, when I mentioned stigma and how we as a community treat these things differently, I feel like the best way to combat stigma is not to just preach about, hey, don't do this, or hey, don't treat it this way. I think the best way to combat the stigma is to normalize it yourself. Let it start with you. And so for me, I feel like in the same way that I would tell someone like, oh, I caught a cold like 2 weeks ago and I needed to take like Tylenol cold and flu, or whatever. Like, it's such a casual thing. And you would not think any differently of me, or you wouldn't treat me differently. And so I think to myself, well, why is it that that's so normal? But if I were to tell someone I had an episode in which I was very anxious, or I had an anxiety attack 2 weeks ago, or I suffered from a depressive episode, or I found myself smoking to help me get past what I was feeling, or I felt myself self-harming, or I had thoughts of hurting myself. These things are seen as very scary. These things are seen as very like, oh my God, this is really awkward. You're telling me something that I really don't think I should be hearing. This feels more private, more intimate. You shouldn't be saying this stuff to me. We treat this very differently. And so I feel like the first step towards destigmatization is to normalize this when we talk about it. So for me, it's very normal for me to just say, I had depression in medical school. It's what I have. It's a condition that I had. I did not seek help for it at the time. I thought that I would just power through it and it would just go away. Turns out it came back during residency. And I decided for myself that, maybe treatment should be something that I should consider for myself. It took a long time, Dr. Suzy. It took a long time to recognize maybe this is something that would help me. It wasn't until my 4th year of residency, this was just maybe, I'd say 3 years ago or so, where I started therapy, individual therapy for myself. And it's a weird thing because you're thinking to yourself, this guy is a doctor, he's a psychiatrist, he gives therapy to others. Why would he himself be in need of therapy? And what I would say is, who delivers a mailman's mail? It's the mailman. So what happens when a healer becomes hurt? They see another healer. And I think you and I, as providers, Dr. Suzy, yeah, we're doing direct care, but I would say for anyone listening to me, All of us are actually healers in our own right. You don't need a medical degree for it, but all of us take care of others. We care for our family, we care for our kids, we care for our siblings, our parents, our friends, whoever may be in our lives, we care for others. The fundamental question that is asked is, who takes care of you? And for me, my answer to that question was no one.
Yes.
No one. I'm not actually taking care of myself. I need to take care of myself. So therapy was a big thing for me to go in. How did I recognize that I needed it? To be honest, perfectly honest, I did not. I did not. I kept telling myself that I don't need it. It's okay. You know, I'm fine. This is for people who have symptoms. This is for people who are like, they have a legitimate mental illness. These are for people who are like suffering or struggling. These are the people who need it. I'm not that. So I don't need it. And it was unfortunate because I feel if I kept denying it to myself, for me, it was almost like I was placing a Band-Aid on a gaping wound, hoping the wound would just magically go away. Unfortunately, it did not. You know, so it came to a point where, you know, I applied for a program at Columbia, and they said that, hey, part of our program is that we need you to be in therapy for your health. And I told myself, okay, I'll do it. And then turns out in therapy, I was like, you know what? This is actually much needed. I needed this.
Alhamdulillah.
And I'm proud to say I have been in therapy for 3 years now with my individual therapist, same therapist I had before. I discuss anything and everything with my therapist. And this is something that I would strongly encourage anyone listening. If you needed a sign from Allah that like maybe I should consider this or maybe I should jump in, take from my story from that. I neglected my own mental health for quite a long time. And I cannot preach to my patients that you need to get help, you need to get treatment, and yet neglect myself.
Absolutely. SubhanAllah. I really appreciate you sharing that. And I think we need to do more of this, you know, sharing our stories, sharing the fact that, you know, Allah Azza wa Jal tells us in the Quran that we will be tested, and we'll be tested in so many different ways. But it doesn't mean that we have to barrel through those tests without seeking the means of help that Allah Azza wa Jal places in our path. And I do feel that everyone in the mental health care field offering all sorts of different therapeutic interventions can often be the means of help that Allah Azza wa Jal is facilitating for you. So I know we've only got a few minutes left together, Dr. Omar. So in these last few minutes, I do want to learn a little bit more about the organization that you are a part of. I believe there's the organization HEAL. I remember when I met you back as a medical student, I believe you were a part of Thrive. I know you're part of FYI. You're an incredible community service leader in your own right, in doing the hard work of really destigmatizing mental health care. Tell us a little bit about your organization.
I am very flattered, mashallah, Dr. Suzy. Thank you so much. To say nothing of the work that you've done, because I feel like this is a pot calling the kettle black. If you're going to compliment me on doing community mental health work, then I would have to say your listeners should know everything you're doing yourself, mashallah. And if anyone can see the stream right now, if you notice right behind Dr. Suzy is Cornerstone Counseling, which is Dr. Suzy's baby that you created. So yes, I will talk about my organization, but I want to make sure, Dr. Suzy, people know about yours as well, and the work that you do at Cornerstone Counseling. Mashallah. I think you and I are literally we're doing the same thing, essentially. You know, so for me, I decided that I don't want to just treat one patient at a time doing this kind of work, because then I'm really just restricted to a clinic, just doing this one thing. And I felt like if you really want to do work destigmatizing, you have to meet Muslims where they are at. You have to go where they are, present to them a face they can recognize and understand, and let the voice be a voice from them talking to them. And so I decided mental health care work needs to be community level. We have to reach people. So we joined an organization, a nonprofit organization called Muslims Thrive back in 2016. This was based off of Thrive NYC. It was an initiative in New York City to make mental health care education something widely available. So we decided the Muslim community should have this too. So we created our own little separate branch of that. Now we rebranded to HEAL Collective to make sure that our work that we do is not just for the Muslim community, it is for literally anyone and everyone, that every faith and every community can benefit from mental health care. But that whatever we do talk about, whatever mental health education or mental health first aid trainings that we do, we always make sure that there's a spiritual or a faith-based component to it. That yes, we'll talk about physical, biological health, we'll talk about psychological and mental health, and we'll talk about social health and interpersonal relations, but you cannot ignore the fourth and major piece, which is someone's spirituality, someone's faith. And so we decided that's a core component of our holistic model of what we're presenting. So that's what Heal Collective focuses on. The other organization that I'm a part of is the FYI, the Family and Youth Institute, which was founded by Dr. Samira Ahmed. And I am a community educator. So part of the FYI is me going to communities and speaking to communities about mental health topics and mental health issues. Pretty much the same work that we're doing in Heal. But I would say if anyone is interested in these organizations, you can check us out at healcollective.net. And if you're interested in the work that the FYI is doing, you can go to the FYI.org and you can learn more information. You can request speakers to come to your masjid or come to your community for that. If you're looking for treatment in particular, I will say neither of these organizations provide direct clinical care. They're education-based organizations. If you are looking for something more direct for clinical care, Dr. Suzy, that is all you. So Cornerstone Counseling is where I recommend listeners to actually reach out and connect. If you're looking for direct, actual counseling services and talking to clinicians who provide direct care.
Absolutely, absolutely. Jazakallah khair, Dr. Omar. We have so much more that we could talk about, but unfortunately we have come to the end of the time that we have together. For our viewers, Dr. Omar is an incredible resource in our communities. He is local in New York. I know many of our viewers are also based in New York. So please look him up, look up the work that he does. The FYI is an incredible institute and initiative. Our own staff went through the mental health first aid training with FYI. The Heal Collective sounds incredible too, and I'm going to do a little more research on that as well. So in this last few seconds that we have together, Dr. Omar, the $1 million question that we ask all of our guests about balance. How do you find balance?
Oh man, shoot. I only have a few seconds.
Yes, Deen and Dunya. How do you find balance in your Deen and in Dunya? Just like when we started the show, you had phone calls, you had someone knocking on your door. You've got a lot going on. How do you find balance?
Well, what I can say is there's a very specific way that I look at balance. I don't know, am I allowed to actually share screen? I think I can, right?
So we only have about 15 seconds left. So
okay. I won't be able to. Okay. So basically, the gist that I'm going to really quickly say for balancing Deen and Dunya is your mental health is just as important in this balance as everything else. That yes, your spiritualism is important to balance. Yes, Deen and Dunya is very important for your physical health and your spiritual health, but do not neglect your mental health. Make sure that you take care of yourself emotionally and mentally. And if you are not, if you're struggling, having difficulty, having a lot of the struggles with this, or your family members or your friends are bringing up problems or concerns that they're noting about your emotions or the way you conduct your behavior or the way you think and feel, please, 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 and I mean this sincerely, Dr. Suzy and I will always echo this, please get help. Please reach out, connect with someone, connect yourself to a provider, connect yourself to a therapist, a counselor, whoever it may be, but talk to a professional. That's the biggest push that I'm going to make, inshallah, for this.
MashaAllah, Jazakallah khair. And I think with that, our viewers have a lot to think about and a lot to explore. Again, think of this episode, this session, if you watched it, maybe it is an answer to one of your du'as, you know, an answer to a difficulty you've been struggling with.
Yes.
So thank you once again, Dr. Omar, for taking time out of your busy schedule and joining us on this show. To all of our viewers, I hope we see you again tomorrow, inshallah, at 2 p.m. Eastern Standard Time on the ITV USA show, Balancing Deen and Dunya.
Thank you, Dr. Suzy. Thank you so much.